This presentation is by Carly Roshinsky and Christy Johnson, and it is on pernicious anemia. Pernicious anemia is a decrease in red blood cells that occurs when the intestines can't properly absorb vitamin B12. Some of the causes of this can be just not taking in enough B12, and we get that vitamin from foods such as meat, poultry, eggs, shellfish, and dairy products. Another cause can be not having enough intrinsic factor, which helps your intestines absorb B12. It also can be, or this can be because your stomach lining is weakened, so your stomach can't produce as much, or an autoimmune condition in which the body attacks the intrinsic factor protein. Pernicious anemia may also have genetic origins. The main effect of the symptoms of pernicious anemia would be the low energy levels and fatigue. Um, these symptoms can affect a person's ability to work, do the things they enjoy, as well as care for themselves and their family. Another symptom that can affect those parts of a person's life would be problems concentrating. In chronic pernicious anemia, you can have nervous system damage, which can affect a person's abilities to perform ADLs in relation to their work, school, activities, taking care of themselves.
So the prevalence of this disease. It's not the most common disease, but there are definitely enough people that do get it within the US per year where it does need to be of concern. So there is 0.1% in the general population that experiences this, and then it increases to 1.9% in anyone over the age of 60. And there are a total of about 200,000 that are diagnosed in the US every year. And out of all of the B12 deficiencies in adults, this one represents about 85% of them. As you can see on this slide, there are many different characteristics that are involved with pernicious anemia. So they'll have a desire to eat ice or non-food things. They'll have constipation or diarrhea, can go either way. They will have lack of energy, fatigue, lightheadedness, pale skin, loss of appetite, problems concentrating, shortness of breath, swollen red tongue, or bleeding gums. So those are signs to look for. Now, if they have had this B12 deficiency for a long time, it will start affecting the person neurologically. So they will become confused or depressed. They will have loss of balance and even coordination. And then they may even have numbness and tingling in the hands and feet. So this is a B12 deficiency. So the main treatment that they are going to administer is going to involve that B12 vitamin, and that can be administered through shots or pills. And vitamins are obviously used to help promote normal body function, growth, and development. So the two cobalamins that aid in deferring this deficiency are going to be the hydroxycobalamin, which is a natural B12, and then also with it being more natural, there are less side effects. And then there's also a cyanocobalamin, which is the man-made B12, so obviously a little bit more side effects. Those are the two main things used, and the other thing that you can even add in is the folic acid. This was a pretty interesting study that we had found. So it's pernicious anemia, the disease and physical therapy management, and it was a case report on one specific patient. And the purpose of this study, pernicious anemia, obviously, like we had mentioned, it can cause motor and sensory loss, abnormal tone, memory deficits, and other changes in mental status over time. So that's why they say PT is necessary within 3 to 6 months after onset, because that is when most of those neurological issues that may occur can be resolved. So this case study specifically, it was a 60-year-old female, and she was diagnosed with B12 deficiency. And by the time she started this PT, she was already quadriplegic, and had severe peripheral and sensory and motor polyneuropathies. So she was already in that neurological state. Um, the PT started initially with active assistive range of motion exercises and progressed into endurance training, tilt table, and then even more exercise, standing and balancing. And then towards the end, which she was in inpatient therapy for about 6 months, they did more biofeedback and gait training. So she kind of just progressed through and continued to get better. Now, at discharge, her muscle tone and range of motion were within normal limits, and strength was rated at good. And the study did say that lower extremity still seemed to be a little bit weaker than the trunk and upper extremity. And then, as well as the tone was a little bit less. Now, the sensation was intact, but again, with that lower extremity, the sharp dull discrimination was more impaired in that lower extremity than the upper and then the trunk as well. Patient was independent in bed mobility transfers and wheelchair when she was discharged. And then the patient continued to come to PT as an outpatient um, for 3 times per week for 6 months. And she was ambulating independently without assistive devices at the end of that 6 months.
This article involved a case study of a 28-year-old female who presented with progressive burning, painful sensations on the upper trunk, and paresthesias of the upper and lower limbs. These symptoms had been occurring for 5 years, and she had been misdiagnosed and mistreated several times before she was correctly diagnosed with vitamin B12 deficiency associated neuropathy. The pathophysiology of this is that vitamin B12 is an essential vitamin that's important in cellular metabolism, but more importantly, in this case, it maintains the integrity of the nervous system. So, the symptoms resulting from vitamin B12 deficiency can include paresthesias, ataxia, and limb weakness. For us as physical therapists, the important part to be able to take out of this study is that patients could present with these types of symptoms without a proper diagnosis, as this woman was. The other part of it is that if somebody presents with this diagnosis of vitamin B12 deficiency associated neuropathy, we can help them manage those symptoms as well.
So just to go over how to assess for pernicious anemia. So obviously first we always take a history. So we're asking if they have had any stomach or intestinal surgeries, if they have any digestive disorders such as Crohn's or celiac disease, if they have any current diet or medication changes, if they've had family history of anemias or autoimmune disorders. And then you will go into your physical exam, so you're looking for pale or yellowish skin, enlarged liver, and then checking if it's gotten to even that neurological state, so is their mental status or coordination affected. And then the next slide will kind of get into more of the testing for it. The diagnostic tests and procedures that are involved in diagnosing a patient with pernicious anemia include a complete blood count. So this is going to check those levels of red blood cells, white blood cells, and platelets. And abnormal results may be a sign of anemia. It's also, or a blood count can also check the B12 levels. So this is going to be checking the levels of the homocysteine and methylmalonic acid. And if those are high, it could indicate pernicious anemia. And so this is for discriminative, they are rated at a level, so it's not saying, the test isn't saying yes, you for sure have it, no, you for sure don't. It's looking at how off those cells are, if they're high or low. So the normal of, for example, red blood cells is between 3.9 and 5.7 trillion, and that varies a little bit between male and female. Evaluatives, so if you continue these tests and then the levels are getting closer or further away from the normal range, you just want to keep evaluating to make sure that they're not getting either more off or something like that. This is also a good predictive test. So as levels become, just even a little bit out of normal range, it could be a good predictor that future disease may occur and that the disease is progressing.